Good afternoon and welcome to Let's Chat with Dr. Celeste MD. I'm your host, Dr. Celeste Reese-Willis. I am a board-certified family medicine physician. I'm a national speaker as well as an Amazon best-selling author. I help busy professionals to find solutions for their acute and chronic medical needs through my virtual medicine practice as well as my concierge medicine practice. Good afternoon, ladies and gentlemen, and welcome. Today I thought that we'd chat about allergies. That's what is going on now and bothering a lot of people out there. Today it's very sunny outside, great time to be able to go outside carefully still with our social distancing intact and get some vitamin D, get some sunshine, get some exercise, take that mask with you if needed. I thought that we'd highlight today though, there are a lot of patients that are dealing with seasonal allergies at this time. And so I thought we'd talk about 4 foods that if you're a chronic allergy sufferer, you might want to avoid these 4 foods during the allergy season to help decrease your chance of developing allergies. Now, you may say, okay, Dr. Celeste, so how can foods affect my allergies? Well, you may want to avoid these foods to try and avoid that trip to the doctor to get your allergies checked on, and you may want to avoid these foods to try and avoid your allergies being triggered altogether. So how do foods affect your allergies? Well, foods contain histamines, which can cause or worsen allergy symptoms. So let's define what is a histamine. As many of you know, we treat chronic seasonal allergy sufferers with antihistamines all the time. So let's first talk about what is a histamine. Histamine is a chemical or substance that's released by a group of cells called mast cells in your body. They're released most of the time in reaction to an injury of some sort. In addition to that, they're released in reaction to allergies or sometimes inflammatory reactions cause a release of histamine. And this chemical is released into your body and can lead to symptoms like itching and sneezing and cough and headache. There's certain foods that are aged or pickled or fermented that have naturally occurring histamines. Histamines are produced typically, especially in the wine and beer process, by yeast or bacteria during that fermentation process. And this is what can lead to sneezing, itching, coughing, or headache. So let's talk about some specific foods that we may want to avoid. Now, first food that we like to discuss are spicy foods. I know that sometimes people say, you know, spicy foods can kind of help open up your nasal passageway, and that is true. However, especially when there's a high pollen content out, you want to avoid foods like cayenne pepper, red pepper seasoning. These are foods that can trigger your allergies, and especially when there's a high pollen content out, and can make your nasal congestion, sneezing, and mucus actually worse. So you want to avoid those spicy foods, especially on those days that we have a high pollen content out. Second food you want to make sure that you avoid or you kind of watch, or I wouldn't advise you to make this a part of your diet if you're a chronic seasonal allergy sufferer, and that's tomatoes. Tomatoes are rich in histamines, and it's known to cross-react with grass pollen, and so it may not be the best choice for you to choose tomatoes right at this moment if you're a chronic seasonal allergy sufferer. Next food you want to avoid, wine and beer. Alcohol is a high histamine level food, ladies and gentlemen. And so that means it's high in histamine content, which means that it can lead to those symptoms that we spoke of earlier, the coughing, itching, sneezing, cough and headache as well that you can get if you have too much of this in your symptom, and or if you're a chronic seasonal allergy sufferer, just know that this can make your symptoms worse. Alcohol, peanut, sugar, processed foods. Lots of processed foods tend to alter the gut, and that's the way that they can alter allergy symptoms or increase allergy symptoms in chronic allergy sufferers. Next, you know, wine is made through the fermentation process. We also know that wine is full of what we call sulfites, and those tend to make allergy symptoms worse in asthma sufferers as well. So if you're out there and you have chronic seasonal allergies and asthma, you might not want to pick up that glass of wine. Yes, that glass of red wine might be healthy for your heart, but might not be so great for your allergies right now. In addition to that, ladies and gentlemen, that last food we want you to avoid are almonds. Almonds are known to worsen tree nut allergy symptoms for patients that have that particular allergy, so you want to avoid almonds. And again, this is through the process of an increased histamine content, which can increase those allergy symptoms like sneezing, itching, coughing, and headaches. So again, that's spicy food, tomatoes, wine, beer, as well as almonds. You want to avoid those. So then the next question most people might ask, okay, Dr. Celeste, so what should I eat? What are some foods that I can eat that will help to with my chronic seasonal allergy symptoms? In other words, are there foods that have like natural antihistamine properties? Absolutely there are. 2 foods I would encourage you to make a part of your diet. Green tea. Green tea contains lots of natural antihistamines. And again, we reviewed just a moment ago, a lot of times we as physicians will treat a patient that is having chronic allergy symptoms with antihistamines. We also will treat patients that are having any kind of allergic reaction. If you're mowing the grass and exposed to too much of the grass and weeds, some people that may have a mild or moderate allergy symptom may react to the point that they have to take an antihistamine. We're using the antihistamine, which means it blocks the histamine, to block that histamine, therefore blocking the reaction that you get and the increase in symptoms of nasal congestion, itching, etc. So drink green tea, make that a part of your diet. The next food I encourage you to make a part of your diet are fatty fish, omega-3 fatty acids. The fatty fish tend to be rich in omega-3 fatty acids, and these are known to provide some antihistamine properties. Now, what kind of fish are we talking about? We're talking about salmon, mackerel, tuna. There actually was a study that was done of children in Sweden, and they looked at these children at the age of 8 years old, and they looked at them at the age of 16 years old. And what they found is that children who had diets that were higher in that omega-3 fatty acid, by the time they reached the age of 16, those individuals had less hay fever or chronic seasonal allergy symptoms. So that was a study that was done in Sweden. Omega-3 fatty acids, you want to make those a part of your diet. And so we're going to avoid the spicy foods, tomatoes, wine, beer, almonds, and we're going to make green tea and fatty fish a part of your diet. That's all we have to share with you, ladies and gentlemen. Let's see who's logging on so we can say hello. And if anyone has any questions. So Mr. Willis, thank you so much for joining. Hi, Rabia. Thank you for joining. Hey, Harley. That's my little niece. Hey, Harley and Zoe. Thank you so much for joining. Hey, Allison. Thank you so much for joining. If you will, please, Allison, give me a text or a call after this broadcast, please. Hi, Celeste. Thank you so much for joining. I hope these tips are something that help you with any allergy symptoms that you may be having. Hi, Miss Black. Thank you for taking time out to join us. Okay, let's see. Miss Chana is asking, what about broccoli? What is that? I think she's saying, what about broccoli? So broccoli is a food definitely that is rich in properties that will help to build your immune system, unless you're someone that has any kind of severe tree or nut allergies. I don't think that's something that should be an issue for you. Hi, Mr. Watson. Thank you so much for joining. Hey, Miss Tate. Thank you so much for joining. And hey, Kim, thank you so much for joining us. Okay, let's see. Miss Davis has a question. Spicy foods, tomatoes, wine, and allergies. Yes, thank you so much for putting that in the chat, Kim. But yes, those are the foods you want to avoid. Hi, Tanya. Thank you so much for joining. Miss Askew, thank you for joining us. Hi, Miss Sellers. Thank you so much for taking time out of your schedule to join us today. Hi, Mr. Craig. Thank you so much for joining. Okay, so Celeste says her eyes are itching like crazy. So we want to make sure that we avoid those foods. If you have Zysol at home, Celeste, I definitely recommend that you would take some of that. That will help with some of that. But if you avoid those spicy foods, tomatoes, wine, and beer, and then add the green tea. I think the green tea would be a great addition for you in particular, Celeste, to help with your allergy symptoms. Hi, Dr. Dia. Thank you so much for joining. Okay, and so, ladies and gentlemen, with that, that's all we had to add with you guys today and talking about allergy symptoms. I hope this information was very helpful for you. If it has been helpful, please feel free to share this with any of your friends, with any of your family members. I hope that you guys are staying safe. If you are a chronic allergy sufferer, please keep these tips in mind to avoid any cross reaction of symptoms and being concerned about COVID-19. Get these things on board. Make sure you have your maintenance meds on board so that we decrease the likelihood that you'll suffer with any allergy symptoms or have to go in to see your physician to be seen, which all of these things help to decrease the risk of spread of COVID-19. And that's something that I hope that you guys are out there and staying safe. I hope you're enjoying this beautiful day that God has blessed us with, and that you guys are enjoying your families today. If you all have any further questions, please put those in the chat. If you're in need of consultation for your allergies, my website is listed below. Some of the information that I shared with you today is actually an excerpt from one of the chapters of my brand new Amazon best-selling book, Vitality. I took a lot of this information from that I shared with you guys today. So if that is of interest to you, you can purchase that on my website as well. With that, ladies and gentlemen, have a good Sunday afternoon. Enjoy your family, love on them and hug on them. And I hope you guys have a good day. We'll come to you later in the week, hopefully with some more information that will be helpful for you. Have a good day. And again, I'm Dr. Celeste Reese-Willis. I'm Dr. Celeste, your favorite urgent care physician. I help busy professionals to find solutions to their healthcare needs through my concierge program, as well as my virtual medicine practice in my brand new Amazon best-selling book, Vitality, as well as through some national speaking engagements that we're involved in. So thanks so much. I hope you guys have a great day. Oh, thank you so much, Kim. I appreciate you guys tuning in and listening. Yes, Celeste, the wine. Yes, the wine. I'm sorry, but it's the truth. I have to speak truth. The wine can make your chronic seasonal allergy symptoms worse. So sorry. It's great for your heart, but not so good for chronic seasonal allergy sufferers. So have a good day. Oh, Miss Reed. Oh, you're a member of Maggie Street. That is my hometown church in Montgomery, Alabama. Thank you so much for tuning in, and please make sure that you share with all the members there. Tell them that I said hello. I hope that they're doing well. I hope that they're staying safe, and I love you guys to pieces. Thank you so much for the support. That means so much to me. Have a good night, everybody. Bye-bye.